All right, treating endometriosis from a hormone balancing perspective. Let's go! Hi, I'm Dr. Joyce Knieff. I am a naturopathic doctor practicing in the state of Minnesota. So in endometriosis, a big portion of the pathogenesis that we know about endometriosis, it is definitely hormone sensitive. And it's hormone sensitive in the way where it's worse when you have more estrogen and less of the other hormones that balance it out. And this can be why conventional therapies like putting people on oral contraceptives can be so helpful, because it basically forces a balance of the endocrine system in terms of the way that it's producing hormones. From a natural perspective, what we can do here then is aid in the detoxification of the estrogen. So if we're thinking about estrogen as in a bucket in your body, then what we can do are two different things here. We can help your body detox the estrogen a little bit faster, or we can turn off the faucet here and reduce the production of your body's estrogen. There's like a third secret option here too, because we know that with the development of endometriosis, it tends to worsen with unopposed estrogen. Unopposed meaning it's not opposed by progesterone. So we can also try to see if we can upregulate the production of progesterone, or at least get your body to balance the production of progesterone and estrogen in order to further regulate what's going on with the endometriosis. So from a detoxification standpoint, some of you have already heard me talk about this. Mainly, we want to help the body detoxify estrogens. From a phase 2 pathway perspective, this is mainly going to be done through glucuronidation, which means that you need to have a good gut microbiome that doesn't have high beta-glucuronidase activity. You can test for this in a stool test, and ideally, you would modify the gut microbiome so that your biome has less of this beta-glucuronidase activity that undoes your detoxification. In the short term, you can supplement with something called CDG. CDG basically just gives like a little decoy for the beta-glucuronidase, high beta-glucuronidase activity gut microbiome to like work on, instead of undoing the glucuronidation that your liver has done to the estrogen to be able to get rid of it. Other things that can help with the phase 2 standpoint is like upregulating the UGT enzymes, which involves things like having enough glycine, magnesium, vitamin B1, B2, B3 to be able to properly detoxify estrogens. And in terms of like phase 1 detoxification in the liver for estrogens, this is where you can kind of push phase 1 CYP enzymes by using things like DIM. DIM in particular can help a lot with detoxifying estrogens and upregulating the liver enzymes that help with the detoxification of estrogens. Let me go over a little bit about the hormone balancing portion in terms of like the faucet piece in another video here, because just want to try to keep everything a little bit more bite-sized here, so stay tuned.